At the time of my last video post, school had just started, and if you went outside, it certainly felt like it was still summer. Now we're about 2 weeks past Labor Day weekend, and school's in full swing. I've got about a month under our collective belts. Um, and if you're not to take away from the historical significance of the holiday, but around here, Labor Day more or less means the end of summer. So some people are glad to say goodbye to summer and the hot weather and look forward to the fall and the cooler temperatures. I've never been one of those people, and neither has anyone in my family really. Um, Fall is all well and good, and there are lots of things I like about fall, but it's kind of a prequel to winter, and we don't like winter at all. Beyond that, fall and the season changes have always been a problem for Bob. It seems like he's particularly sensitive to the shortening of the days and the changes in temperature and so forth. That really has a significant impact on his symptoms. Usually we find out that he tends to lean toward depression in the fall months, and sometime around January, early spring, he starts to climb back up into mania. So changing of the seasons is always kind of a difficult time for us. Um, it can be a difficult time for really anybody whose child has a psychiatric condition, or if you yourself have a psychiatric condition. A lot of people experience seasonal affective disorder, which is a form of depression that's been linked to vitamin D deficiency caused by a lack of sunlight during the winter months. There's also really a lot of evidence pointing toward the changing seasons exacerbating anxiety and depression and multiple other psychiatric illnesses. So it does have a significant impact on all of us, really. Um, I do tend to be in closer contact with Bob's psychiatrist during the fall when he's going through the depression. Um, if you read the blog, then you know we recently changed his medications and increased the doses of a couple of his medications. And so far, he seems to be doing really well in school. So that's a plus. But I do still notice a lot of the mood swings at home, and he's still having a lot of problems with nightmares and um, just having trouble, not really trouble sleeping, but trouble with excessive worrying and anxiety. So we're going to be keeping an eye on that. It's just a really good time of year to keep an eye on yourself and keep an eye out on your kids to see if you notice any changes with the seasonal patterns, see if you notice any increases in their behaviors or any symptom changes. Bob's psychiatrist did tell me last spring that a lot of her clients are on totally different medications depending on the time of year. So it definitely has an impact. In the meantime, I'm going to address the sleep issue in an upcoming blog post, so be sure to come back and take a look for that. I am Angela McClanahan. I'm the author of Life with Bob, and I hope you will come back and check back. Thanks.